Patients frequently ask, how did this happen to me so suddenly? I mean, I was fine like 2 weeks ago, and now all of a sudden I find out I've got this terrible heart problem, and they tell me I'm going to die or have a heart attack. Maybe I've had a little heart attack. Well, the answer is it really didn't happen suddenly. It's been going on a long time. The fact is, the good Lord designed us, well, or Charles Darwin if you buy that, but designed us very well so that we have a lot of redundancy in our system. You have to narrow an artery a lot before the blood supply is limited enough for you to have symptoms. So the disease often has been going on in people since they were in their 20s or 30s, but it slowly accumulates, rust in the pipe, if you will, before the pipe really starts to decrease its blood supply. Now, you can demonstrate this at home with a garden hose. And anybody who's ever tried to pinch off a garden hose to get it to stop the flow of water through it, if it's got a significant flow, you realize how hard it is. You have to sometimes pinch the hose 3 times to get it to stop. And yet you also notice that once you start getting it, the blood flow, or the flow of water through the hose to decrease, it's easy to get it to stop at that point because you've almost got it. And that's what happens with your arteries. You have good flow when you have a 50% blockage, a 60% blockage, still the flow is fine. So all those years you've built up to that 60% blockage. But boy, once you get to 70%, the difference between the flow at 70% and 75% is huge. And all of a sudden you get symptoms that are sudden, and yet really it's a disease that's been going on a long time.